Bless the Lord, oh my soul, and all that's within me. Bless his high and his holy name, Brother Brandon O'Doy, Assistant Minister of the Hope Church of Christ. And once again, we give God all the glory, honor, and praise as we start our third community care conference. With us again today is Sister Roxana Dunn. She is a master's in social work and so many other wonderful things. And we also have a special guest, Sister Jamise Sky, who is a nurse practitioner. And we just are so privileged and blessed to have both of these sisters on sharing information that's real, relatable, and reliable for us during this COVID-19 pandemic to be able to rely. And we're putting our faith and trust in God, but be able to rely on the information that they're sharing with us to make this time where we are quarantined and where we're dealing with some situations that we typically don't deal with, that God and be sure to know how to operate. And we know surely God is still in full control. Right now, I want to bring back Sister Dunn, let her introduce Sister Sky and our topic for today. Sister Dunn.
Okay, hello everybody. Today I'll be introducing Jamise Simonette. She is a nurse practitioner. She works with adult gerontology, acute care, infectious disease nurse, and a practitioner in internal medicine. So today she'll be talking about disparities in disease potentiating in times of crisis. And she'll be talking about the healthcare disparities in the African-American community. So let me just say that Jamise, she works on the front line, so she sees what is going on with the COVID-19 firsthand. So she's here to answer some questions that I have for her and that some people may have for her, just to talk. She's here to have a general conversation about COVID-19 and what to expect if and when you do have to go to the hospital, or if you're seeing signs or you don't have any signs. So I'm going to let Jamise introduce herself and, just segue into what she needs to talk about.
Well, thank you guys. Thank you so much for having me on the platform, Brother O'Doy, Sister Roxana. Can you guys hear me okay?
Yes, you're good.
All right. And sometimes my computer cuts out, and if so, just give me some sort of sign. All right. So yes, my name is Jamise Nichelle Sky. I am a nurse practitioner here in the South Florida area, Miami, Florida. I have privileges in a few hospitals in the South Broward and North Dade hospitals. And so I've been a nurse for over 15 years and a nurse practitioner for over 5 years, and specializing in acute care, adult gerontology for those 5 years, and infectious disease in the latter 4 years of my practice as a nurse practitioner. And so today I was kind of tasked with bringing forth information, like a realistic, a practical perspective of what is being seen kind of on the front line. But also, if I had to, kind of tag or title, as Brother Daniels would say, this discussion, it would be, a crisis within a crisis. And so that is talking more about the disparities in disease, potentiated in times of crisis. And so I just want to get into it because, I want to be respectful of everyone's time. But this thing is really multifaceted, and I do believe that, more discussions need to be centered around what's happening in terms of COVID, in terms of just, disparities in health as an overall issue. And so I was, challenged to really figure out how can I peel back the layers of so much. I mean, the magnitude of COVID, and I'll just tell you, COVID, what is like COVID-19? I don't have a specific a definition of COVID. What I can tell you is that a lot of research, data is being put together. We know it's a virus. We know that it damages the tissues of the lungs, right? It attacks and basically causes death to the tissue of the lungs, right? And a lot of inflammation is resulted when that happens. And so it's attacking the immune system as well. But guys, there's a lot of viruses, a lot of bacteria that are in the environment. And so I want to just put that out there. as well. And I want to, let you guys know that COVID, we're all crazy about COVID. I mean, I don't want to use that term in a derogatory way, but we're all like, focused in about COVID. But there's a lot of things that have been happening over the years, over the decades, over the centuries in terms of our health. And now that we see COVID here is kind of just putting accentuation on what was already, a problem for our community. And so there's so many health disparities. And when I'm talking about, disparities, different groups, right? African-American, the elderly, the homeless, HIV population, the obese population, there's disparities that they deal with, even the children who are obese, they deal with disparities, and in the schools and everything like that. But when it comes down to what's happening with COVID-19, we find that a lot of African Americans are dying. They're having a greater fatality, mortality when this virus comes into the system. And so, how can I say? As I mentioned, there's a lot of viruses, there's a lot of bacteria that we come into contact with, in a daily, time frame. But this virus is a lot more virulent. It is it is quite infectious, and the rate in which it does the damage is is accelerated, from which I have not seen in my time as a medical professional, nor as in my lifetime. And so, is there a cure for COVID? There is no cure at the moment for COVID, but there is no cure for virus, period. And virus is something that your body's defenses has to take, take into account to fight it off. Our body fights off virus. Our body fights off bacteria. There is, antibiotics, they help, but essentially our body has to do ip part as well. I'm just trying to make it as plain terminology as I can so that, most people can understand what I'm saying. But there's always going to be a virus or a bacteria that our body has to deal with, okay? And so I just want to park that and bench that so that this is a real crisis, but the crisis started prior to this, and there'll be other crises that we have to deal with if we don't deal with the underlying issues at hand. And so I just want to give a statistic that I read, and in which it says, African Americans account for over 70% of COVID-related deaths, despite representing 30 to 40% of the total population. And so, as I mentioned about the healthcare disparities, African Americans are among the top in terms of those skewed numbers, right? In terms of issues and matters such as hypertension, such as diabetes, such as increased risk for death on stroke, increased risk for obesity, having a sedentary lifestyle, being inactive. We just overall, and this is I don't have the exact number, but we are on the top of all the statistics when it comes to those that I mentioned. But African Americans are more likely to die at an early age from all causes, and it is just that blanketed, and that's serious. It's not to be taken lightly. We have to be aware, because I did a post yesterday. Knowledge is not just power; knowledge is life. And more so now than I would ever say I would ever know it to be. Knowledge is life at this point. And so thank you to everybody who's jumping on. So yes, we're talking about, you know, the disparities in the African-American population. Also increase, we're at the top for heart disease, we're at the top for cancer, at the top for unemployment, at the top for limited or reduced access to healthcare, at the top for living in poverty. And so these matters are all relating to COVID, in the fact that I mentioned is something that attacks your immune system. Okay, it brings it into a state of dangerous levels of inflammation, and so it causes like an overreaction of the immune system. So you know, something like asthma, let us say, where it's a hypersensitivity, you know, there's a lot of inflammation involved with asthma. This is the best way that I could kind of relate. You know, when you have an asthma attack, you feel like you can't breathe, you know, you're drowning, you're gasping for air. It's due to all that inflammation and cytokines and all these inflammatory reactions that happen. And so it's similar to what happens with COVID. But however, when you have an asthma attack and you go to the doctor or go to the emergency room or whatever, what have you, they're going to give you some medications that might reduce the inflammation. Well, with COVID, we're actually finding that these medications that would work well for an asthma exacerbation are actually potentiating and worsening the condition and the outcome for an actual COVID positive patient. And so how does that look in the emergency room? How does that look in the front line? It's very grim. It's very disheartening. It's a tough situation to be on the front line, guys, and to see you know, people of all ages, because I know that there's been a lot of information. At first we were hearing, right, and you have to, you know, you were hearing that, you know, this is not a disease that, you know, this is the other people disease. Not true. This is affecting all, you know, all races, all ethnicities, you know, in all ages to a certain degree. But we are finding that people, individuals who have these comorbidities, these underlying conditions that I mentioned, high blood pressure, diabetes, asthma, so prevalent in our community, are the ones who are succumbing to mortality. And stop me at any, go ahead. Mm-hmm.
Okay, yeah. I had a question. So I wanted you to talk about access to healthcare with in regards to insurance, uninsured. Talk about that disparity, because I know people are worried they don't have insurance. People who have insurance, what is the care like for them? What does it look like when they come into the hospital and they have these symptoms of COVID-19? What does that look like when it involves the access to care in insurance and uninsured? How does that look?
Oh, okay. That's a great question. So prior to, and you and I kind of spoke about this a little bit, you know, prior to this whole, you know, pandemic, this whole crisis in the community, you know, when you would come to the emergency room with an issue, you know, that you felt needed to be addressed, and that was an emergency, many times you were undertreated, you were maybe, you know, not even diagnosed, you know, due to, if you didn't have uninsured, I'm talking about the uninsured population. And so now with this crisis, it's no better, guys. It's not improved. When you go to the emergency room, there's already disparities being seen in the people who are tested because they're uninsured, right? They're not being tested, you know. So, you know, you may feel like you're presenting with certain symptoms, but if it doesn't hit like, you know, pretty much every parameter on their guideline, more than likely you're not going to be tested. And there's many examples of this I'm seeing, and it's a sad commentary, a lot of sad commentary happening with COVID. So you may have, some fever, or maybe you have fever and a cough. But if you don't have fever of certain degree, and if you haven't had cough for a certain period of time, then you just may not, with or without insurance sometimes, you just may not be tested for COVID. And I want to speak on the testing for COVID for a moment, because whether or not you're positive, it's not going to change their treatment so much. Because if you are positive, and they're going to tell you the same thing, because they're not going to test you, number one, and they're going to tell you, well, go home, isolate yourself, quarantine yourself, hydrate yourself, treat yourself with Tylenol, stay, practice social distancing. Those are the things they're going to tell you whether or not you were tested for COVID. So if you weren't tested for COVID, or you're coming in with certain symptoms, they're going to send you away and tell you, to practice those activities. And if you are tested for COVID and you are positive, they're going to tell you the same thing. Go home, practice, social distancing, quarantine yourself for 14 days. Depending on the severity of your case, when you are, present in the positive finding, you may or may not even, be admitted. And that's due to, a lot of different reasons, resources, insurance being, it's a sad situation that's happening. But you're talking about this crisis being brought upon a crisis that already was, which is the healthcare system. Okay, so basically, if you can avoid, going to the hospital, because if you were not positive, right, and you go to the hospital, now you are increasing your risk for exposures, because there are a lot of people that are having the same mindset. Well, I have a cough, let me go run, let me go get tested, let me go run to the, and now you have this, increasing number of, exposures, that the outcome is still going to be the same. And tell me if I'm not being clear in my articulation with this, because if you're feeling sick, and and you want to be tested, the best practice is probably to find a smaller testing area in your community, in your neighborhood. Like I'll like to get one of those, get a number, or that we can find for centers that are testing, because they're popping up. They are centers popping up, as opposed to going to like a huge hospital or a bigger, hospital, because you just increase your risk to being exposed. So that was a really long, explanation. Tell me if I answered your question, or if you need me to elaborate in a different way.
Okay, so Jamise, what I hear you saying is, whether if you test positive or not, let's just say you go into the hospital for a totally different reason, but you think you may have, and they test you or don't test you, the outcome is going to be the same. They're going to basically send you home, tell you to monitor your symptoms, take your Tylenol, take your temperature, unless it is that serious enough for you to be hospitalized. Is that what you're saying?
Yes.
Oh,
yes.
Okay.
That's what we're seeing. And some people will demand testing. And if you are uninsured and you don't hit all those parameters, you will not be tested. Even if there's one thing that they can say that you didn't check off this guideline, and you're uninsured, you will not be tested. And so this is why it's so concerning and so alarming. And the magnitude is so big, because people are presenting with certain symptoms that may not check off all the boxes, and likely, they likely have been exposed, or are would have positive serology were they tested. And so really the numbers, we don't know the real numbers. That's the real fact. We have some data, and the data that's being pushed out there on the CDC and everything like that, but a lot of testing is not happening. And we do know that eventually over 70 to 80% of the population will be positive, because again, this is a virus just like any other virus. We come in contact with virus and bacteria, microbes every single day. We carry bacteria on our skin. Bacteria, no matter how much you hand wash and shower, there's bacteria that live on the skin, okay? But it doesn't cause illness, does not cause disease. So, it's it's going to be nearly impossible, for people not to be exposed to COVID.
So what I hear you saying, Jamise, is not, so you're saying that 70 to 80% will contract it, but it's not if, but when you contract it. Given the state of the healthcare system already, I want you to give us some tips on what we can do to fight COVID, because it seems as if it's inevitable in order for us to avoid this thing. But what can we do to make sure that our immune system is boosted in order to fight this? And don't get me wrong, listen, everybody, we're having a candid conversation. We're not trying to scare anybody. We're not trying to make you feel bad. We're not trying to make you think that we're having a realistic conversation with real professionals, with real facts, someone who's working on the front line, who's here to tell us this is what's happening and this is what we need to do. But whether if we test positive or not test or get tested, the fact of the matter is some of us could clearly be walking around here with it and not know it. So in that case, what do we do? Because it seems like this virus, it's about fighting this virus. It's not so much of it being a cure for it, but how do we fight this virus? How do we fight it?
Okay, yes, Roxana. So that is what I'm saying. It's not a matter of will, but a matter of when. And I'll just give, so this weekend I saw about 8 cases myself, 8 of my 16 patients, and so many sad scenarios. But for example, three of the patients that were discharged were COVID positive patients. And so you have to think about, them going into the community, them going into their home, even if they're, asked to quarantine, which they are. We are asking everyone to quarantine for 14 days. If you have to go home and you don't live alone, you're exposing, or potentially, exposing, the family members in the household. And unfortunately, we're seeing scenarios like this. We're seeing, people go back into the community, into their home to quarantine, and, whole households, or majority of the household is becoming infected. Some are succumbing to more, death, and others, they pass the virus, because over time your body fights this virus off, and then you move on. But to prevent the spread of it, sorry guys, to prevent the spread of it is nearly impossible. And so you have to get back to the basics. You have to do what you can do to put yourself in a state of fortitude. All right, you got to build your body's defenses. It's almost like you have to be able to, build your immunity. How does that look like? What does that look like? It's a couple things. It's also multifaceted, because, our body, I look at it in 5 dimensions, right? I look at the spiritual, I look at the mental, I look at the physical, the emotional, even though the financial, all of those things, because we're talking about, how, stress comes about and lowers your body's defenses. Anxiety brings your body's defenses down. Depression, down. You're sad about, how are you gonna, you don't have money to eat, down. Or you don't have the right foods to eat, down. You're questioning God, you're just all worried and anxious, everything. So all of those dimensions are something that are things and areas that we need to address as a whole when you're talking about how do we fight COVID. So I guess I'll just focus on just a few, which is like, the physical, right? What can we do? It's important for us as a people to try to reduce our risk for these underlying conditions, as I mentioned, right? So what were those that I mentioned? I mentioned things such as high blood pressure. I mentioned things such as diabetes. Okay. Asthma is more so, it's like inflammatory. A lot of allergens cause that, but there's things that we can do to help ourselves in those areas as well. So we need to, if I had to give you like a few pointers, first of all, you need to exercise your heart and expand your lungs. So what does that look like? Walk 30 minutes, okay? Do a minimum of 30 minutes of physical activity daily. Now, you had heard your physicians, most of you on here, probably have seen a cardiologist a time or two in your life, and they tell you to do your 30 minutes of, cardiovascular activity for your heart health. It's on the CDC, 150 minutes, which is 30 minutes, 5 days a week, right? I can do 150. Our dear sister, Elena McCann Brinson, that's something that she talks about all the time. As simple as it may seem, it has, the potential to reduce your risk in many different areas. As you're reducing, your BM, you're increasing your cardiovascular, response. You're working the pump, right? You're also reducing stress in your body when you do that, believe it or not, because endorphins and all those things start to work when you are moving your body. It's like this, like, I don't like working out, guys, but I in my mind, it's a matter of life and death. That's how I look at it. We're having a candid discussion, so it's just that serious. Okay, if you can't walk, and we're talking about, a time in which we have to find ourselves isolated, or in close quarters, there's other things that you can do. If you can't take a walk around the community, there's things you can do in your home. Do some squats, do some jumping jacks, do some push-ups. I don't know, whatever it is, move your body intentionally for 30 minutes. That's a big one, and I had to spend that time on it because it's huge. Okay. Because when we come out of this situation, people are going to really have to take a look at the things that they could have done differently. But I find that we need to be having that look. We need to be taking that look right now, because this coronavirus, we don't know when we're going to be out of the woods. That the bottom line is, we don't know how long we're going to be dealing with a situation to this magnitude. And so there should be no waiting until this is all cleared up and over before you start doing, and we start doing as a community, and for ourselves and for our family, and encouraging that our family members do the same, the things that we need to do to mitigate, illness. Okay, because the doctor, and I don't bash doctors, I don't bash any medical professionals, but the vast majority of the medical professionals that you go to see, they're not going to tell you, the real about, nutrition. They're not gonna go into detail. They're just not gonna do it. They're not gonna tell you the importance of detoxifying your body. And I mentioned that because it has proven to be so critical, because of all these toxins and insults and, things that we come into contact with on a daily basis. It is critical, the air we breathe, to cleanse our cells. Okay. So that's a big one too. And I won't go into detoxing because this whole conversation could turn into that, because I'm a huge proponent of detoxing. But anyhow, the other thing you want to make sure you're doing is having adequate hydration, water. We're not talking about juices. We're not talking about, sweet tea. We're not talking about Gatorade. We're talking about water. Okay, making sure that you're having the adequate amount of water hydration, recommended for your body weight. Okay, the other thing is sleep, adequate sleep. And these things seem so basic, right? But we don't do it. And as a cumulative effect, we see these things showing up in disease in our body, right? So adequate hydration, exercise, water. You want to have adequate nutrition. Okay, so what does that look like? That means that when the next time that we have to go to the store, we're not picking up and filling the basket with snacks and honey buns and things that offer very little nutritional value, and that are basically just fillers, calories, adding abdominal girth, right? And so you have fruits and vegetables. Okay, think about the purchases that you're making in these times. They're just going to be, you're just going to find that they're more critical than ever. And we have to start changing our mindset about how we eat, because the food is paramount. I'm trying to watch how I talk, because I like to get real with my patients, and none of you guys are my patients. But
listen, we all family here, right? So you can get real with us as real as possible, because I get real with everybody and tell them what it is. And we need to know, because Jamise, you're on the front line. So we recommend all realness that you have to give it to us, and we accept it, and gratefully and wholeheartedly, because no one is giving it to us real like this. We're not having real conversations. We see it on the headlines, we see other things, but we need to have these real conversations with our community, because this is affecting Black communities, and we need to be able to receive this for what it is. So don't make excuses or apologize or try to, hold your tongue back. We need to hear the real information. But with that in mind, we have 4 minutes now. But go ahead.
Okay, all right. Yeah, so the FDA is not your friend. So basically, make sure that you are, getting adequate, nutrients. You want to try and get nutrient dense foods. Okay. And to be honest with you, what we have out there in our main grocery stores, they don't have nutrient dense options. But of the options that they have, fruits and vegetables, grab for those. Go for those first before you hit those other aisles. Okay. Because the food is killing us. That's the bottom line. And so make sure you get a good vitamin. Just make sure you have good, adequate nutrients coming into your body, because those are the things that our cells, thrive and feed off of. And so we're talking about the internal state. And so you have to do whatever you can to, mitigate the outside, environment. Okay. So you have to make that internal environment as, balanced and, strong, fortified as you can. Okay. So nutrition is a huge one. All right. That's going to build up your, immune defenses. Okay. So walking, adequate hydration, good nutrition, rest, do things that can reduce your stress levels. We're finding that a lot more MIs or heart attacks are coming in. And the brother, Dr. Ashby talked about this, right? MI, strokes. We're seeing a lot more of that, domestic violence issues. This is all stemming around the increased numbers going up in our community because of COVID, because of the stresses. All of these things, are interconnected, and it's hard for the people to see the big picture. But there's a lot of devastation happening on many different levels secondary to this. And so, with finances and such like that. So it's just really something very difficult to kind of condense to, a 30-minute talk. But I hope that, some of those things you can implement and implement it right away. Don't delay. Now is the time. I feel, faith without works is dead. And people say, God will. Well, God will, for us to be sharing this information with each other. And this is not anything that I'm making up. It's really a lot of devastation happening, and it's only going to get worse. We have to take control of the controls. And so with that, I'll just leave it there.
Well, we appreciate it, Sister Jamise Sky, nurse practitioner. And I had no idea, even up to just this very moment, that you were in infectious disease. I tell you, God puts all of the resources in the church that you need. You, Sister Roxana, Sister Dr. Trudy Gallard, so many others, Jessica Cadet. We are truly blessed. We've got 20 seconds. Tell us the most important thing, because everybody didn't join at the top. Most important thing you want us to take away from your presentation today.
Whew. Oh my goodness. Hand hygiene, stay home. If you don't, stay home, hand hygiene, exercise daily, get some exercise in daily, and focus on address those 5 dimensions of your health, which is your spiritual, mental, emotional, physical, and financial. Try to address those components. Do what you can do to prevent disease, because an ounce of prevention is worth a pound of cure. And so it is our responsibility, is your responsibility to take control of your health, because if you leave it in the hands of the provider, you're not gonna be happy with what may happen.
Well, we thank you so much. An incredible presentation.